Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
All right. Hey, everyone, and welcome to another session of the PreMed Virtual Summit. My name is Max with PreMed Made Simple, and I'm extremely excited for our next guest. So we're joined today by Dr. Marinelli, who's a physician and the Director of Advising at Med School Coach. She's also a former admissions committee member at UC Irvine School of Medicine, so she's actually been on both sides of the application process from both applying and also assessing candidates on her own. So I'm extremely excited to have Dr. Marinelli here. Welcome.
Thank you so much for having me.
Before we get started, I do want to start with a caveat, which is that there are lots of different reasons that people can take a gap year, and there are really limitless ways that students could actually spend a gap year. So really what we're going to be talking about is some of the core ways here, both of why students might want to take a gap year, and then overall how to spend the gap year. And overall, Dr. Marinelli is going to lead that discussion in general. But so, Dr. Marinelli, my first question for you is, what exactly does the term gap year mean?
Yeah, that's a great question. Just to define it really. So traditionally, somebody applying to medical school would apply their junior year of college, and it takes about a year or more to actually go through the application process. So that would mean that they matriculate or they start medical school the fall after they finish their senior year. Now they apply over a year ahead of time. A gap year, or some people call it a glide year, is really just not applying that junior year and applying later. So that could be applying their senior year. So after they graduate their senior year, they have a year off while they're applying. Some people take multiple gap years, but that's what it really signifies, is not that direct matriculation from undergrad into medical school.
Okay. And so how common is it for students to take a gap year?
You know, it's becoming more and more common. Back when I was applying to medical school, which is over 10 years ago, I inadvertently took a gap year. And at that time, it wasn't that common. And I thought like, oh no, this is such a big deal. Like, I'm going to lose my trajectory to medicine. But now in the last 10 years or so, it is becoming more and more common. I don't have exact numbers, but from the applicants I work with, I probably would say about 50% or more of applicants are taking gap years.
Okay. And then so is this whole idea of a gap year, is it something that med schools look down upon?
No, not necessarily at all. And I think now that it's becoming more popular and more common, medical schools actually like to see gap years as long as the student is doing something productive. I think that's kind of the biggest thing here, is that it's okay to take a gap year as long as you're doing something that's going to contribute to your application or to your personal growth. But if you're just taking a gap year and, sitting on the couch and watching Netflix, then that's not going to look very favorable to admissions committees.
Yeah, absolutely. And just from my own experience with what I've seen with my own med school class, I have so many friends who took gap years. I myself took a gap year. It really seems like the majority of the people actually in my class took a gap year, and people did really cool stuff with their gap year. So I'm excited to talk some more about that with you.
Yeah, absolutely.
So you mentioned, so gap years, it can be more than 1 year. Mm-hmm. That's right. And then you also mentioned the term glide year. Is that literally synonymous with gap year?
I've heard them used interchangeably, but if there's any other definition out there, then I'm welcome to hear it. But I've heard them used interchangeably, but most often it is referred to gap year.
Okay. So let's say, hypothetically, you've kind of touched on this already, but let's say you're not going to take a gap year. So when exactly do you need to have your application submitted?
So if you're not going to take a gap year and you're going to matriculate straight from college into medical school, then you would apply the spring of your junior year. The application for the AMCAS or AMCAS, that's the primary allopathic application. The date for submission changes a little bit each year, but it's usually at the end of May or very early June is when you'd actually submit that primary application. And again, that would be the spring of your junior year.
Okay. I think the really important thing that you said there is that So basically, you need to have all of your pre-med recs done in 3 years. Is that right? If you're planning to not take a gap year?
Pretty much. As far as prerequisite courses, I mean, we definitely recommend that you have them completed before the MCAT because that stuff is tested on the MCAT. So you want to have it ready for that. And most medical schools do like to see your prerequisite courses completed before applying. However, there's a bit of a caveat to that. You don't necessarily have to have the courses all completed. If you have a couple that are scheduled, you can indicate that on your application. Like, I'm scheduled to take calculus next semester. So medical schools see that you're still working to complete some of those prerequisites. But in general, you want to have most of them done because you need that MCAT before you apply.
Got it. Okay. And then, so beyond just the pre-med prereqs that we just talked about, your MCAT needs to be done. And then, of course, you need to have like your clinical experiences and your research experiences. All of that basically gets compressed into 3 years instead of your full undergrad trajectory, right?
Exactly. Yeah.
I think when I initially came in as a pre-med, I just assumed that the default was going directly from undergrad into med school. And I really didn't fully understand that required such a compression of my undergraduate time. So I think that's a really important point for pre-med to understand.
It does. I mean, pre-med is hard enough, but then you have to stay on track with all of your courses, your degree courses, of course, too, because you're planning to graduate in 4 years. And you have to make sure that you're really boosting up your resume in those 3 years. And I mean, I think you have to imagine, too, a lot of people may start off college not sure they're pre-med. So maybe their freshman year, even their sophomore year, they're not really on this path. And then they go, oh, junior year, I have to start applying. That's a lot of experience and a lot of courses they have to rack up before the application.
Yeah, absolutely. And I think that's a perfect transition into some of the reasons of why students should take a gap year. So Dr. Marinelli, could you tell us some of the most common, good, solid reasons that students use to take gap years?
Yeah, so absolutely. So I think the number one thing that I see is they're just not ready with their extracurricular activities. So as you mentioned, we kind of alluded to, when you submit your application, you want to make sure you have your clinical experience, your research experience, community service, leadership experience, volunteer experience. I mean, that's a lot of different stuff that you need to have on there, and more if possible, because just to make yourself stand out as much as possible as an applicant, you want to have well-rounded, in-depth experiences. So sometimes people are at their junior year and maybe they just started a research project, and applying with only a few months of a research project is just going to be inadequate. Or maybe they just haven't had enough time to spend really getting clinical exposure or shadowing. So, they want to spend some time making that experience more in depth. So I think that's probably the number one reason I see people take gap years, is just they haven't fluffed up their application enough. I would say number two, tied with number one, is, as we were talking about, like getting those prereqs done. And that kind of corresponds with grades. So maybe this person just didn't know they were on the pre-med track. Maybe they did, and maybe they didn't perform well the first couple of years. So they need to either get more of those prereqs done or boost up their GPA to make it competitive enough to apply. The average GPA, the average MCAT just keep going up every single year. And so, they really want to be as competitive as possible when they submit that application. I think the other thing that I see pretty commonly now is, since the MCAT is such a huge factor in applying to medical school, lots of times students will use that gap time to study for the MCAT, or kind of space out their courses so they have more study time. Just use that to kind of wiggle that MCAT test date around a little bit more. And then I see a lot of people just taking gap years because of personal reasons. And that's fine as well. Maybe they have some financial problems. They can't matriculate straight to medical school. Maybe there's some health issues or family issues, that require their attention. And that's totally fine as well. And I see that happen pretty commonly. And I would say, along with that kind of personal reasons, is maturity. There's a lot of people that graduate high school and start college when they're 17, and they end up graduating when they're like 20 or 21. And those people are, expected to matriculate into medical school right around then. That's sometimes a little bit difficult position to be in. A lot of introspective and, very thoughtful candidates will think about, well, maybe I should take some time to develop myself more time for personal growth, and then start medical school. And that usually reflects very well on their application.
I think that's a fantastic list. And I'd love to dive in a little bit deeper to each one of those. So do you mind if I ask you a few questions about each?
Of course.
So let's start with extracurriculars. So is when you're looking at how much extracurricular experience you have, whether it's volunteer experience, work experience, clinical experience, is it as simple as just a basic number to know whether you have enough? Or how do you basically gauge to see whether an applicant has enough experience?
That's a great question. So, I think it's kind of two-part. You want to have the number of hours, at least a decent number of hours in each category. But then you also want to have depth of experience too. It's one thing if you just volunteered in an ER and you have 500 hours, but all you did was sit, at a table and, directed somebody say, okay, your loved one is in room 4, it's back there to the left, versus if you actually shadowed doctors and worked with the nurses and helped them out and saw cases and, assisted in medical care. So there's depth and breadth of experience. Of course, you need to have experiences that were meaningful, that were significant, that have contributed something to you as a person. So it's a bit twofold. You also want to have some numbers too. And there's not actually a lot of data on the numbers that most medical students have. It's very, very minimal. If you look, you can definitely find data on the number of experiences applicants had, like how many clinical experiences, how many research experiences, things like that, but not like the total number of hours. But I usually say it's aim for about the 200 rule. So at least 200 hours of clinical work, at least 200 hours of community service, at least 200 hours of research, or kind of based on what the project is. And then shadowing is different. 200 hours of shadowing is a lot of hours of shadowing. So maybe 50 to 100 is pretty competitive there. And then having some leadership experiences sprinkled in there as well, not necessarily number of hours, because it could be combined with other experiences. But even that, those minimal of 200 hours for those three, 50 to 100 hours of shadowing, that's kind of at the bare minimum. That's still a lot of time to dedicate outside of what you're doing just to get your undergrad degree.
Yeah, absolutely. So specifically for the shadowing hours, so the 50 hours of shadowing, is it enough just to do one single specialty, to basically do all 50 of your hours within the same specialty, or do you recommend trying to get involved with as many different specialties as possible?
Yeah, so I think the ideal situation is trying to get different specialties and hours with each specialty. That kind of gives you a broad range of experience, lets you, see what different practitioners are practicing and doing and helping with their patients. But lots of times people are very limited on their shadowing experiences and what they can actually get. So if you have to do 50 hours with one physician, if that's all you can really acquire, that's fine. But the ideal situation would be to spread it out.
Okay. So it sounds like it's the same kind of thing, how you need to basically have a twofold attack. You need to get enough hours, and then you also need to make sure that you have very good, high quality association.
Exactly. Yeah, exactly.
And then this is just kind of related to research or to extracurriculars, but how about research? Do you think research is something that you absolutely must have, that should cause students to take a gap year, or not?
I think so. Now with the competitiveness of medical school admissions, almost every applicant has a research experience. It's upwards of, last time I checked, I think it was like 94% or something in those numbers of, that applicants had research experience, that ones that actually got accepted to medical school. So I think absolutely you need to have research experience. Usually the easiest way to get research is while you're in undergrad and contacting a professor in the sciences and working in their lab on a project. So sometimes during the gap year, it could be a little bit harder to get a research experience because you don't have that connection. So oftentimes people will either maintain a relationship with a professor and stay on like kind of as just a volunteer researcher if their university allows that. Or I've seen a lot of people get into clinical research since that doesn't necessarily involve like a university and like a professor that you'd work directly in their lab.
And does it need to be science related or maybe medically related as well? How about what field should you choose to do your research in?
So I've heard mixed answers here. And again, I kind of always speak to the ideal situation and then what is feasible for an applicant. So ideally, I think that you should have some type of medical related or science related research, because there are certain skills that an applicant is learning there. You're learning, how to use a microscope, how to do PCR, how to look at things on, or how to culture cells. I mean, there's tons of different little minutiae that you actually learn that can be helpful in medical school and beyond. So I think that's important. Learning the scientific method, of course, is a big part of any research. So as long as you're getting that, then I think you can extend out to something else. So again, I think it's ideal that somebody has scientific research or medical related research and something else. However, if you only have like a research project in psychology or sociology, but you still work through that scientific method of developing a hypothesis, testing it, analyzing results and making conclusions, and even maybe writing it up in a poster or a paper, then that should suffice. But again, I think there's the ideal situation where you should have both, and then there are limited opportunities for lots of applicants. So at least if they have something else, that should be okay.
Okay. So let's move on to the second one that you had talked about, which is basically needing to improve your GPA. So let's just start with the most basic question. Really, what should be a pre-med's goal, like math and science, like pre-med GPA, and then a cumulative GPA?
So I would say for both of those, above a 3.6 at the very least. It's going to be pretty tough to get into a U.S. allopathic school without a 3.6. So obviously the higher the better. Again, the ideal situation would be a 4.0 in both of those. But I mean, at least if you're applying with a 3.6 or above in the science and your cumulative GPA, you should have a pretty fair chance. And of course, the MCAT also weighs in on that as well very significantly as far as their overall chances. But I usually encourage people, that they should be somewhere around a 3.6 or above before they apply.
And that's for both GPAs as well?
Yeah. There's not that much difference in the science and the cumulative GPA. For matriculants into medical school, I don't have the number off the top of my head right now. I usually do, but I'm blanking on it. But so I think it's about a 1 point difference. So I always just try to lump them together and say they need to both be up to here, because a 1 point difference, isn't super significant.
Yeah, absolutely. Okay, so let's say that I graduate from college with, we'll say like a 3.4 or something like that. What are my options for a gap year and ways that I can improve my GPA?
Yeah, so I mean, a 3.4, it's kind of like, well, you could take some more classes and try to improve that. So maybe just one gap year is fine for them, because what they could do is they would finish out their senior year and they would have those senior year grades on there. So you said graduated. So I guess if you were if you were in your junior year at a 3.4, maybe just finishing out your senior year and doing really well would boost up your GPA enough to be competitive. This is where it becomes a little bit more tricky. You need to look at both GPAs. So let's say your cumulative GPA is a 3.4, but your science GPA is a 3.1. Well, taking another year of classes isn't going to really push you up to that competitive point or that mark for your science GPA. So you may need to think of other options. So for an applicant that, has a very low GPA or, needs a significant difference, well, maybe they should start considering a post-bac or a special master's program, or just a master's program in general, to really differentiate that undergrad GPA to what their academic potential is.
And what's the difference between a post-bac and you said a special master's program?
Yeah, so a postbac is kind of you do not earn a degree. You basically go back to undergrad, either at the undergrad you were at or a different one, and take courses that will contribute to your undergrad GPA. So, I mean, this could be a whole nother discussion about postbacs and SMPs. But usually a postbac is good for somebody that, one, needs some of the prerequisites, like maybe they didn't take OChem, so they can go back and take they can do a postbac and take OChem. I think it's also good for those people that are borderline. So maybe they have that 3.4 cumulative and science GPA, and they just need like another year of undergrad classes to really boost up that number. So a postbac may be good for them. Whereas a special master's program is a program that's specifically designed for pre-meds who maybe didn't perform very well in undergrad, but need to boost up their GPA. However, this is different than a postbac is that these are graduate level courses. So they do not factor into that undergraduate GPA. Literally on your application to medical school, you'll have your undergrad GPA total, and then you would have a graduate GPA total. And that's where the special master's grades would go to. So I think these ones are very good for somebody that maybe didn't do very well at all in undergrad, have their prereqs done, but maybe they graduated with 3.0. That's going to be really, really hard to take a ton of undergrad courses to pad up that GPA. So instead, they do a special master's program that's going to be its whole separate line, so to speak. It's going to be, I almost consider it as like a clean slate. Hey, this is how this person did in undergrad. Not too well, but look at how well they did in this special master's program. Hopefully this is a true reflection of their potential. So that's kind of just at the very basics of SMPs and postbacs, but it kind of gives hopefully a little bit of an overview for some people where thinking of, do I qualify for doing one of these programs in a gap year?
Okay. And so with the special master's programs, you're not combining the GPAs. You're saying that, right? You're saying that they're two totally separate. And so basically what med schools are looking at is the trend between the GPAs more than anything. Is that correct?
Yeah, exactly. So, I think it kind of gives them an ability to evaluate an applicant outside of what they did in undergrad. Medical school admissions committees, they know that not everybody is on a straight path and does perfectly in undergrad. They know people lots of times have upward trends where maybe they started off kind of in the lower side of the GPA and then did very well as they went on, but still maybe their bottom line number is not that high. So allowing them to see, another GPA that you performed very well. And of course, that's the caveat here. You have to perform well in these programs to really show them what you can do. It allows them to see what your potential is or where you could actually stand academically against some other medical students. And that is a part of the special master's program too, since they are designed with the pre-med in mind. A lot of them actually mirror first year the curriculum of first-year medical students. So sometimes people in the special master's programs will actually take courses with first years. They sometimes take the same national exams. So if you're performing high at that level, then medical schools can kind of think, well, if they're performing this well in this SMP, then they should be able to do well in the medical school class as well.
And then so you mentioned that the SMP classes are graduate level courses. And then let's say I've already taken all of my requirements throughout undergrad and I'm looking at a postbac. Am I just literally going to retake the same classes I took, like Gen Chem, Orgo, Physics, those kind of classes?
Yeah, no, I mean, you definitely don't have to. Sometimes people need to retake those classes. I usually recommend for those pre-req classes, like you're saying, Gen Chem, organic chemistry, biology, physics, list goes on and on. If you have a C or below in those classes, then you should consider retaking them. Some medical schools don't even accept a C or below. So in that case, you really have to retake them. So there is that option to retake those courses in postbac, but you don't have to. You can take whatever courses you're interested in. I see a lot of people that kind of find a little niche that they're interested in, like maybe they take neurobiology classes or psychology classes. Typically, it should be related to science because you're trying to show your academic potential in the sciences. So you should try to take, some upper division tough science courses in that post-bac.
So beyond a post-bac and a S&P program, are there any other options for students to increase their GPA, or are those really the two main ones?
Those are really the two main ones. The other thing I sometimes see is what I like to call do-it-yourself or DIY post-bac degree. Not degree, just post-bac. So instead of actually going to a formal post-bac program, that student just stays on at their university or goes to another university and just takes kind of a random assortment of classes, or maybe classes that they're interested in, but it's not in this formal program. There's also some schools have something called extension programs, where usually you graduate and you're able to stay on and take these extension classes that, again, are just going to be more undergrad classes that can contribute to your undergraduate GPA.
Okay. All right. So before we move on, I think, to the next topic, which is talking about the MCAT, is there anything else you want to add in terms of ways to increase your GPA overall in your gap year?
No, I don't think so. I mean, I think it's just important for somebody to, if they're deciding if I need to take a gap year or not, think about that bottom line number. I mean, like I said, you could have an upward trend. Maybe you've done really well in the sciences, but I mean, they are going to look at what your overall GPA is, both science and cumulative GPA. So if you're not at a competitive number, then instead of just applying and not getting in, you should really start thinking about ways and feasible ways that you should address that area of your application.
Yeah. And I think one thing that students sometimes don't understand is that oftentimes these things like a GPA or an MCAT, if they're too low, they don't even look at the rest of your application, right? You basically get filtered out with that initial thing. So even if you have the most amazing story, you can't make up for it if you have a GPA that's not even getting looked at.
Yep. And that's kind of the tough part about admissions. I mean, there's a lot of tough parts about admissions, but that's kind of the bottom line, is like you have to meet a certain number, both MCAT and GPA wise. And if you don't, you're exactly right. A lot of schools are going to just screen past you, and you won't even ever get your personal statement read. So exactly, you really should be competitive with those numbers before you do all the rest of the work on your application.
So moving on to the third thing you brought up for a good reason to take a gap year is you mentioned the MCAT. So do you think it's a reasonable use of a full gap year to be studying for the MCAT the entire time?
Probably not the entire time, but let's kind of go to the traditional route again. So somebody matriculating from their junior year into medical school after they graduate. So they apply that spring of their junior year. You ideally should have your MCAT done before you apply. So most people are going to take the MCAT sometime in the early spring, usually around April. Sometimes people are earlier than that. So let's say you take it like the latest April or May. That is a tough time to take a serious test. I mean, you're still taking your undergrad courses. Lots of times people don't have exclusive time to study just for the MCAT where they're not taking courses. So they're studying for the MCAT while they're taking their courses, and then they take it, and then they have to complete the application. There's just a lot to pack in a small amount of time. Whereas, somebody that's planning a gap year, maybe they just don't even bother taking it the spring of their junior year. Maybe they finish their spring, they study all summer, and then take it at the beginning of fall their senior year. And then it kind of even gives them more flexibility, because if they didn't score where they wanted to, they could retake the test even in the next several months and then apply. Or they could decide, no, I need more time, and not apply that spring of their senior year. So it just allows more flexibility. So I think that, most people probably don't need that whole time to study for their MCAT, but it allows most people to have like a few solid months just dedicated to MCAT studying, which is quite hard to have when you are an undergrad.
So I think it's similar to what we talked about at the initial discussion at the beginning of our conversation, which is that you're compressing school so much that basically when you allow for that gap year, you release some of that compression, right? Yeah. You allow for a little bit more comfort zone.
Mm-hmm. And I mean, I think kind of going back to with what we talked about is that you should have all of those prerequisites done before you take the MCAT, because that's really your foundational knowledge needed for the MCAT. So again, if you take it that spring of your junior year, that's also saying that you've had all those prerequisites done before you're even starting studying for the MCAT. So that makes it even a tighter schedule, as you're saying, to have all of that coursework done, then study for the MCAT, and then take it. If you take it during that gap year or take it later than that spring, then you're kind of just opening it up a little bit. You can maybe finish your courses in the spring of junior year. You could take one during the summer if you needed to, whatever it is to kind of allow your schedule more flexibility.
So I think we've covered some really good reasons of why students should take a gap year. But I'd also like to cover sort of the flip side as well. Do you think there are any like bad reasons, like reasons students should avoid when trying to decide whether to take a gap year?
Yeah, I mean, I think as I kind of mentioned in the beginning, a gap year is fine as long as you're doing something productive. And in case this wasn't covered previously to this talk, so when you apply to medical school, you have a primary application that is submitted to every school that you apply to. And then after that, you have secondary applications, which are sent by almost every school you apply to as well. And those consist of several essays that you have to kind of explain, different aspects of your application or talk about different areas of, or just talk about different things. And then the last leg of the application are interviews. So I see so many secondary essays. I mean, probably 70% of them will have a question that says, if you did not matriculate, or if you did not, how does it go? If you took any time off after graduating, or if you are not planning to graduate and go straight into medical school, what are you doing during that time, or what did you do? So basically it's asking you, are you taking a gap year, or have you taken a gap year? And if you did, what have you done during that time? So they want to know. And this is not going to come up only in the secondaries. Lots of times this is going to come up during the interviews too. So as long as you have something productive to say there, I just wasn't quite ready with my academically. I really wanted to boost up my GPA more. I wanted to take more prerequisite courses. Great. I didn't have enough clinical experience, and I really wanted to get more of an in-depth experience working in different hospitals and different specialties. Great. But if you're sitting there and you're trying to figure out something to write and you're like, oh, I really didn't do anything during that time that's productive or adds to my application, then that can look very negative. Like I made the joke earlier, if you don't have plans and you're just kind of sitting and watching Netflix for that year, you're going to have to explain that year to the admissions committees, and they're going to want to see something substantial there. If you don't have it, then that is going to be a negative mark on your application.
And does it need to be medically related? What if it's like always been my dream to backpack throughout Europe for like 6 or 9 months or something like that? Is that legitimate or no?
No, I think that is. I mean, again, like I said earlier, taking a gap year for personal growth. I mean, think about all of the stuff that you gain when you go and backpack through Europe, resiliency, problem solving, determination. There's a lot of different skills that somebody is actually acquiring when they do something like that. So it doesn't necessarily need to be related to medicine. I do, again, in the ideal situation, I do recommend that people try to continue their activities, their medically related activities during that gap year. So let's say they volunteered at a hospital while in undergrad. Try to continue doing that during that gap year time, even if maybe you take a couple months off to backpack through Europe. But when you get back, try to continue those activities as well. But it doesn't necessarily have to be related to medicine. I've seen a lot of people that do international work. I've seen people work on startups, different things like that. As long as it's, contributing to your character, contributing to your personal growth and making you a stronger candidate.
And so you kind of touched on this a moment ago when you referred to the secondaries, but let's say I have like this fantastic job that's going to get me some really good clinical experience. Is there anywhere other than secondaries that it fits on the AMCAS, or is it really just only on the secondary application?
So you can put planned activities on the AMCAS application. So it's a little tricky, but you want to put the start date is the earliest you can put a start date for a planned activity would be the day you submit the application. And then you can say the end date would be the proposed day of matriculation to medical school. So, people don't know that exact date. So if they plan on, doing a job from when they submit their application to when they actually matriculate into medical school, they would say, June 1st. And then the end date would be, August 1st of the following year or something like that, where they're going to possibly matriculate into medical school. And then they can write in that description, I'm planning to start this job on XYZ date, and it's going to include this, this, and this. My responsibilities will be X, Y, and Z. And so that you can include that information on the AMCAS application. It looks much better, of course, if you've already started it, because then you can at least show what you've actually done rather than what you just anticipate doing.
Yeah. So actually, when I applied to medical school, I had just gotten a job as a scribe, and basically the start date they had told me was like a 2-week period that was right around the application time, and they basically said pick your day. And I actually remember intentionally choosing a day earlier on that so that I could actually include it, so I could put a nice full write up on it and include it as a feature activity as well.
Yeah.
So,
yeah, exactly.
So that leads us nicely into clinical experiences, which you talked about briefly at the beginning of this conversation in terms of the number of hours that you ideally would want. So do you have any clinical activities that you really recommend as just being fantastic gap year students for students who are trying to look to get more basically patient encounter experience?
Yeah. So, like what you just said was a scribing job. Scribing is awesome. Lots of times, and you probably can attest to this, you're not directly interacting with a patient, but you're right alongside a healthcare practitioner throughout the entirety of your shift. So you really get to see everything that they're doing. You're involved in a lot of the medical terminology and coding and things like that. So it's a great experience. So medical scribing is awesome. You get very in-depth experience, and you get paid, which is nice. I see lots of people doing EMT work, which is also pretty great. You get paid. It doesn't require a huge amount of training, and you get some more hands-on patient care than you would if you were just a volunteer. The other thing I mentioned in regards to research, but this also counts as clinical experience, is clinical research. I think clinical research is an awesome field for postgraduate student to get involved into, because they're working alongside healthcare professionals and they're working with patients. Lots of times in clinical research, that research assistant or that postgraduate student, those are the people that are going to be like consenting patients into studies, screening them into studies, following them longitudinally throughout the study. So it's an awesome experience to really get in-depth patient exposure and experience working in the medical field.
And so regardless of which of these jobs you choose, so whether it's scribing or EMT or maybe doing some clinical research of some kind, it's got to be difficult, particularly in that fall, maybe to winter part of the year, because you're going to be going on a lot of med school interviews. Do you have any recommendations for, should students bring that up on their initial job interviews, or should they specifically look for jobs that they know are more flexible with that?
Yeah, I think probably look for jobs that are more flexible. Maybe not taking a full-time job, taking a part-time job so you can move your schedule around a little bit. I worked full-time during my med school interviews, and I worked for a neurosurgeon actually, and so he was very understanding. I was able to really change my schedule around and strategically try to plan interviews close to each other. So I only had to fly to somewhere, during that week instead of, every single week. I think it's just kind of one of those things you just have to make happen. It's not going to be easy and it's not going to be pretty, but you just kind of have to make it work. But I wouldn't let that stop you from getting a job. Because the thing is, too, you could think, well, a lot of interviews start late summer and early fall, but sometimes people don't get interviews until the beginning of the year, the following year. So you could anticipate, taking a bunch of time off and say, no, I'm going to turn this job down. And you don't even get interviews until, 9 months later. So, I think it's more about trying to get that position, maybe mentioning it, maybe trying to gauge how flexible your schedule is to ensure that you will be able to do it, but just kind of wing it as it comes up.
Yeah. Yeah, I think it really is something you kind of just figure out on the fly. And then one thing I'll say too is that, so some of these jobs, like scribing, I think is just like the most classic example, which really tends to be geared towards pre-med students. So I would be really shocked if you came across a scribe program that gave you a huge amount of pushback when it came to taking school interviews.
Right, exactly. Yeah. Especially too, if you have a part-time job, usually you can be a little bit more flexible with things rather than a full-time, 9 to 5 every single day. They expect you to be there type of job.
Awesome. So I think we covered a huge amount of ground covering gap years here. Is there anything else you want to add before we finish up our conversation?
No, I think, if you're thinking of a gap year, look at your application and, try to be honest with yourself. I think that's kind of one of the biggest flaws or biggest mistakes that applicants make is they overestimate their competitiveness. They overestimate the quality of their application. And they don't really take into account how very competitive the process is. I know, we've been through this. It is grueling. And so if you think that, maybe I need to take a gap year because I could really boost this area, or really I should focus on this, and you're thinking that's a possibility, that's probably the right answer, is to actually do it and to take the gap year. The gap year is not going to hurt you unless, like I said before, you're not doing anything. But if you're going to do something to boost up your application, that can only stand to help you. And one final thing that I struggled with a lot when I told you I inadvertently took a gap year because I applied the first time, wasn't a strong enough candidate, and then had to reapply. So that put me into a gap year, whether I liked it or not, was I was so concerned about, oh my gosh, another year till I achieve my goal of becoming a doctor. And I thought that, that's going to just add so much more time. Another year in becoming a doctor is a drop in the bucket. It takes such a long time to become a practicing physician that another year is not going to make a difference in the long run. So don't make that a determining factor. Be honest with yourself. Have a very honest appraisal of your application and your competitiveness, and then use that to decide if a gap year is the right thing for you.
Awesome. Thank you so much for all the advice, Dr. Marinelli. This was really fantastic. Thank you.
Thank you so much for having me.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and medschoolcoach.com for more essential resources in your medical school journey and beyond.